So before taking radiographs, it is important to make sure that you have a dosimeter or a dosimetry badge. That's what we use at our clinic here, dosimetry badge. We keep them stored outside of radiology. Basically it works, there's a small film wrapped in like a light-proof envelope, and it measures your exposure to radiation. The way that we get readings from them is every 3 months at a time. We send them off to the company. They give us the readings and then they send us new ones. When you wear it, it should be worn on your collar outside of your lead. It should be worn every single time you are taking x-rays. Every single x-ray you take, you should have this on. And then there is a maximum permissible dose per person, which is why we send them off and get readings every time to make sure no one is reaching their maximum dose. The way that you measure that is you take the age of the person, subtract 18, because you have to be at least 18 years old to be taking radiographs, and then you multiply that by 5, and that's your maximum permissible dose for the year. So I have a report right here that we're just going to look at real quick. So here I have a report. This is everybody that takes radiographs in the clinic. And go ahead and look at Brittany right here. This is the current exposure. This is the year to date. And then this would be her lifetime exposure. So right here for the year, and then Brittany is 32 years old. So I'm just going to calculate real quick. 32 minus 18, 14 times 5. So that is 70 REM. So she has not yet met her maximum permissible dose for the year. Okay, I'm going to demonstrate how to put on the personal protective equipment, or the PPE, that is used in radiology. It's important to inspect each item before you put it on to make sure there are no holes or cracks, because if there are, then that portion would not be protecting you from the scatter radiation. So first thing I'm going to go ahead and put on is my lead gown. Goes on like this, and then it has the straps that wrap around the back, and then I wrap mine around twice. Make sure it's on tight so that it doesn't fall off while I'm taking radiographs. Then I have my thyroid shield. It goes around my neck like this. I'm going to go ahead and put my dosimetry badge on. It goes on my collar right here. I'm going to make sure that that is outside of the lead. And then I'm going to put on these gloves. And then that is all of the PPE I have here. Some other clinics will provide protective eyewear, glasses, but what I would do is just look away from the beam while taking radiographs if I'm using manual restraint to protect my eyes. Okay, so right now I'm going to discuss a few general things about radiation safety. First of all would be the methods of restraint used in radiation. There are a couple different methods. One of them is just called physical restraint. This is like when the patient is awake. It requires physical restraint of the patient. If you are restraining a patient physically, then you should of course have all of your PPE on, and look away from the beam and try to be as far away from the radiation beam as possible. Another form would be chemical restraint. This is the most ideal. This is just when the patient is sedated. Basically, you can manipulate them however you want to on the table. You can use positioning aids to help with that. And then if you're using the positioning aids and you've got them in the right position, and you don't need physical restraint because of the sedation, you could physically leave the room potentially, or stand behind like a lead-lined wall, or just position yourself far away from the radiation beam. It's just to ensure that you get less exposure to the scatter radiation. Speaking of positioning aids, I have a few right here. One of them is tape. So we just use this medical tape. You can tape down limbs with it. I'll demonstrate that later. And it does not show up when it is exposed. So that's a really good one. There are ties that you can use to tie, like pull limbs back perhaps and kind of tie them down to the table. And then there's also the boat. Some facilities may have what's called like a V trough. We call ours the boat. It's just a foam V-shaped trough that can hold the patient in dorsal recumbency. Other than PPE, like I said before, some physical barriers would be standing behind a lead-lined wall. Our whole radiation suite is lined with lead, the walls and the door. Another one would be distance. So the farther away you are from the actual beam, the less scatter radiation you are exposed to. Another kind of way to ensure that you're taking radiographs in the safest way possible is to reduce your exposure time as much as possible. You want the shortest effective exposure time without preventing, you want the shortest effective exposure time, but you also want to prevent retakes. So basically, the less time that the beam is exposed in the room, less radiation exposure. The danger of radiation is it basically has the potential to damage your cells. It can damage them beyond repair. It can even kill them. That's why it's really important not to let any portion of your body be exposed by the beam directly, even if you are wearing lead, even if you have your lead gloves on, because the lead gloves and the apron and the thyroid shield, those only protect against scatter radiation. They don't protect you from the direct beam. It's really important to make sure there's no non-essential people in the radiation suite while you're taking radiographs. This is because any person that works with radiology has a maximum permissible dose, the MPD, of exposure to radiation, which is measured by your dosimetry badge. So if they don't need to be there, they're being unnecessarily exposed. They're just adding radiation to their, MPD, which is unnecessary. All of this kind of goes along the same theme, but you need to make sure to take as few images as possible while producing, results that the doctor can make a diagnosis from, because, the patients aren't safe from the radiation either. Like, it has the same effect on their cells. So that's why, take as few images as possible. You don't want to be in here, trying over and over again, trying to get the perfect shot. So a saying is check twice and expose once. So check all your measurements, your KVP, all of that. Just take your time doing that so you can only expose the patient to as few beams as possible. So pregnant women and children being exposed to radiation. So because children are growing at such a fast rate, their cells are more sensitive to the radiation beams. It's not ideal for pregnant women to be working in radiology. Now, pregnant women could still decide that they want to do it, or they might need to do it for their job. This decreases their MPD for the duration that they're pregnant. so they're allowed much less exposure. The most harmful time for a fetus is in the first trimester. The most harmful time for a fetus to be exposed by radiation is in the first trimester. That being said, I mean, all radiation is potentially harmful. That's mostly it for safety. Hello. So today I'm going to be taking pictures of Dolly the boxer. We have a digital x-ray system here, so I'm going to start by setting her up in the computer. So I'm going to go to registration, and I've written down her information right here. So I've got her ID number is 140. Do her last name first. Then her first name. She is a female, and she is 11 years old. And then I'm going to register her. And then the first picture we're going to take of Dolly is going to be a craniocaudal radiograph of her radius and ulna. So she is a canine, and it's going to be her front extremity. Okay, so Dolly is sedated, and the first picture we're going to take is going to be a craniocaudal view of her radius and ulna. Because our digital x-ray machine, calculates the KVP and the MA for you based on the species and the region of anatomy that you're taking an x-ray of. So I'm going to put that in over here first. I'm going to go extremity, and then canine, and then CC for craniocaudal. And then I'm going to okay, so we're going to position her sternally. And then I'm going to have Brittany hold her up and also push her forelimb forward. And then I am going to collimate in on proximal to her elbow and distal to her carpus, and also to the mid shaft. I'm going to center on the mid shaft of the radius and the ulna. And I'm going to utilize the tape to keep her paw in place. Make sure that's still centered. Okay. Okay. And then I'm just going to flip this and label this is her right forearm. All right. Okay, so the next view we're going to take is a ventrodorsal view of her thorax. I'm going to use the boat to help position her in dorsal recumbency, and I'm going to use the ties to pull her forelimbs cranially. So first, I'm going to go ahead and sort of get her in the right position. And then Brittany, if you could help me move her onto her back. So I want to center on the midline of the caudal border of her scapula. And then I'm going to collimate from her thoracic inlet to the first lumbar vertebrae. So I'm actually going to push it down. Okay. To set this to thorax and then canine VD. Right. And this is her left side. Okay. Okay, so the next view we're going to take of Dolly is going to be the ventrodorsal view of her hips. We're going to have her in dorsal recumbency in the boat. First, I'm going to collimate from the crest of her ilium, just distal to, and then distal to her patellas, then lateral to the greater trochanters. I'm going to have Brittany restrain her, just pulling her forelimbs cranially, just to give some, so that to pull her straight. And then as I take the picture, I'm going to rotate her stifles so that they're parallel to each other in the table, and also so that her patellas line up with the trochlear groove. But first, I'm going to set her up right here, so select pelvis, and then canine VD, and then put our gloves on. Let me just make sure she's and just go towards you a little bit, Brittany. Right there. Okay. Okay, so now I just need to label it. Okay, so I'm going to demonstrate how to retrieve the images that I took of Dolly to pull up for the doctor to review them. So I'm just going to go in the system here under database. And I'm going to type in her last name, and then pull up the date from when I took pictures of her, and then we did it on 2 different days. And so we want it from the 28th of February, and then I just click on it, and all the images are pulled up down here. Now the doctor can come through and pull up the images to look at. Okay, we're going to do a barium contrast study on Waffle today. We already took a VD and a lateral preliminary shot so that we could figure out the settings for her. Now we're going to administer the barium, and then take an initial lateral and VD once we give it. And then we're going to take a shot every 15 minutes. So go ahead.
Go.
Okay, so it has been 30 minutes since we gave the barium, so this is going to be our 30-minute picture. We're going to take a VD and a lateral. It's close. Can't take it seriously. Perfect. Your feet, lovely. Great. So we're going to continue taking lateral and VD shots of waffle every 15 minutes until an hour passes, just until the barium passes through her GI tract. And if it's still there after an hour, then we're going to take shots every 30 minutes until it passes completely. Okay.
I'm Kurt Crocker. I'm Emily Burke's preceptor for her radiology course. During the course, she's been learning a lot about her anatomical landmarks for colonization. She's been showing a lot of improvement with her measuring the region to be x-rayed and the appropriate KVP, MAS, and MA settings. Again, we use a digital radiograph here, so there isn't a lot of practice we can do with film, but I have definitely seen improvement in her ability to know what regions the doctor's looking for on a radiograph, as well as how to set the machine and anticipate the calculations it's going to make for us with it being digital. I don't think there are any improvements that she needs to make for this course. I think everything that she's done, she understands the reasons behind doing it, and she has shown nothing but improvement. So I think she's a great addition to our technician team here, and I'm looking forward to her being done with school and passing her board and becoming a registered technician like myself.